Now, this situation in Guinea-Bissau is a massive clash between a new direction in U.S. health policy and global medical ethics. Basically, a U.S.-funded study wanted to take 14,000 newborns and split them into two groups. One getting the hepatitis B shot at birth, which is the global standard, and the other waiting 6 weeks. Now, the goal pushed by, RFK Jr.'s health department was to hunt for broader health effects of the vaccine. But the WHO stepped in and called it unethical, pointing out that in a country where nearly 1 in 5 people have hepatitis B, delaying that shot is incredibly dangerous. Now, since 90% of babies infected at birth end up with lifelong chronic infections that lead to liver cancer or even cirrhosis, the WHO argued that intentionally leaving these infants unprotected, even for a week or for a few weeks, could cause irreversible harm. And former Health Minister Magda Robalo did not mince words when she said, and I quote, "Guinea-Bissauans are not guinea pigs." Now, joining us on the conversation, we have Dr. Shabir A. Mahdi, Dean of the Faculty of Health Sciences and Professor of Vaccinology, University of Witwatersrand in Johannesburg, South Africa. And we also have Professor Oyewale Tomori, virologist and former president of the Nigerian Academy of Science in Lagos, Nigeria. Thank you so much, gentlemen, for joining us at this time.
Thank you for having us.
So let me begin with Dr. Mahdi. Dr. Mahdi, I would love to pick your brain, on this particular story, because the WHO states that 90% of infants infected at birth end up developing chronic lifelong infections. So by withholding the birth dose from 7,000 infants, are they gambling with the lives of the children who have a 20% statistical chance of being born to an infected mother?
Absolutely. And I think we need to firstly pose the question, why do the study now, when there's overwhelming evidence that the birth dose of hepatitis B vaccine does bring about a significant reduction in the risk of a child who's born to a mother that's infected with hepatitis B being infected themselves. In a place such as Guinea-Bissau, between 10 to 15% of all pregnant women actually have hepatitis B. They're actually infected with the virus, and they pose a risk to that virus being transmitted to their baby. Even though a birth dose of hepatitis B is not 100% effective in reducing that acquisition of hepatitis B by the baby, it at least reduces that risk close on to 60 to 70%. Now, the reality is that the WHO has set a goal to eliminate hepatitis as a disease as close as 2030. And by 2030, they're wanting to bring about 90% reduction in terms of the number of new infections. And one of the tools that we have available to us to attain that goal is, again, a birth dose of hepatitis B, and particularly in countries where there's a very high prevalence of hepatitis B in pregnant women, as is the case in Guinea-Bissau. Guinea-Bissau is one of just a handful of countries that are yet to introduce a birth dose of hepatitis B. A birth dose of hepatitis B is almost universally practiced in high-income countries and a majority of low-middle-income countries. But certainly in many African countries, the coverage with that birth dose is not what it should be, despite there being a policy for babies to receive that birth dose. But like I mentioned, Guinea-Bissau is more of the outliers, including on the African continent, that is yet to introduce a birth dose of vaccine.
Oh, okay. Now, you asked the question, why do the research now? And I want to forward that question to Professor Tomori, because former health minister, like I said earlier, did say that Guinea-Bissauans are not guinea pigs. And the WHO explicitly warned that resource constraints cannot be used to justify withholding proven care. So if the goal was to study broader effects of hepatitis B, why was the study not designed to compare the vaccine against an even better intervention, rather than comparing it against no protection at all? Professor Tomori, let's have your thoughts.
Can you hear me?
I can hear you. Please go ahead.
Hello? Yeah, okay, thank you very much. I thank my colleague for laying out the foundation. I think this is, for me, the question was, what is really purpose of the research? It's not even about whether protecting against hepatitis. It is trying to find out what they call non-specific effects of vaccinating children. We have been told that quite a large number of hepatitis is very endemic in this part of Africa. That first dose is it doesn't solve the problem, but it's a way to ensure that there's no mother to child transmission. If you take that off, and like WHO said, that means this guy's opportunity of having a possible chronic infection for the rest of his life. The second doses may be, but that first dose is so important that missing it out is actually all indirectly sentencing that child to a life of disease, you know. And so for them to come it up, bring it up, and the question is, why is it now? Are we using, granted, Guinea-Bissau has not even started it, it's going to start in 2027. Granted that, you know, they have not yet started it, but the fact that you can deliberately come out and put some children on placebo, on something that we already have a vaccine for, is unethical, totally unethical. And I'm glad when I was at the African CDC meeting when this was discussed. And part of the story, the Guinea-Bissau government came up and said the document they have is not sufficient, and they want to redo a study in their own country to see whether there's need to do this kind of studies. And African CDC also promised them the technical support, which they don't have. So on what basis was that initial decision to do it done when Guinea-Bissau had no technical experts to advise their government? These are some of the issues that came up at the point, apart from what WHO said, in the fact that this is totally unethical.
Definitely. Now, coming back to you, Dr. Mahdi, public outrage forced the government to suspend this trial. What does this suggest to you? Does it suggest a total failure of informed consent, or did the researchers underestimate the medical literacy of the people of Guinea-Bissau?
Possibly both. So firstly, it strongly indicates that there was very little engagement with the communities and informed engagement with the communities where the study was meant to be taking place. Had that sort of community engagement taken place, it would have involved people from the community. It would also have involved medical workers in that community and people that are knowledgeable about hepatitis B and the impact that it's having in adults in Guinea-Bissau, because obviously this is a disease this is a virus that children get infected at a very young age, but the consequences thereof is only realized in adulthood. So engaging with adults that actually do have hepatitis B, and there are many of them, unfortunately, in Guinea-Bissau, as part of this community engagement, really would have informed the community positioning in terms of whether the sort of a study which leaves half of the children that are born at risk of contracting a virus that is going to result in life-threatening illness, whether that would have been acceptable from the community perspective, and the answer to that is clearly no. So there was lack of community engagement. But the reality also is that health literacy in many of our countries, in many of our communities, is not at the level that it should be. So that requires not just community engagement, but it also requires engagement with people from within the country, with the ethicists in the country, with the scientists in the country as part of that community engagement. And I'm not too sure whether that took place outside of this very sort of ring-fence environment where this particular group has been operating, not just now, but also in the past.
Okay. Now, researchers Peter Abbey and Christine Starball-Ben argue that vaccines have non-specific effects on the immune system. But even at that, is it responsible to test these fringe theories, by removing the primary protection against a known terminal virus? Let's hear from you, Professor Tomori.
It's not even something to talk about. Non-specific effect, what does that mean? Possible mortality, they don't have what about it? Compared to one being subjected to chronic infection of hepatitis all its life. You balance the risk and you balance the benefits. the non-specific effects compared to somebody having hepatitis for the rest of his life. You don't even bring those two things together. They have no. And let me put it straight away. I think at the back of the whole story, at that meeting which I mentioned about African CDC, the Minister of Health of Guinea-Bissau actually did confirm they didn't have enough information to go ahead with these studies. So where did they get the approval in the first place? Where did the approval come for this study to be carried out? And why is African CDC, I mean the CDC or whatever of the US, insisting that it must go on? You remember a few recent moments when the US government decided to reduce the number of vaccines they're giving their children. They're looking for a way to test this for a decision they've already taken and to use African children to answer the question they're looking for. That's the problem. And that's what you do when you become a donor, a recipient. And that's a message to us in Africa. I believe we have enough resources to do some of these things, but we'll not use our money for what we should use it for. And so any donor can come and do anything to us and then threaten us. They say that even though we say we're not going to take it, they still come and put out, we are going to do it. Over what?
All right, now, the WHO called the trial's single-blind design biased and low utility. So, Dr. Mahdi, if the results were always going to be scientifically questionable due to their design, was the risk to these 14,000 babies ever worth it?
Not privy to the protocol itself, so I can't really speak about the study design. But the bottom line is that there's absolutely no justification to randomize children in where there's a proven intervention that works and that is life-saving. There's absolutely no justification, even if it means one child's life is going to be compromised by being randomized. There's absolutely no justification. The hepatitis B vaccine is a vaccine that has been shown to be safe when given to newborns. It's a vaccine that is shown to reduce the risk of a baby that's born to a mother with hepatitis B, with a baby being at lower risk of being infected. And like I mentioned, this is a life-threatening disease. So in that context, there's absolutely no justification to withhold vaccine as part of the study design, and especially that birth dose, which is the dose that really brings about a reduction in terms of vertical transmission. Now, for argument, you might well be able to make a case of doing this randomized control type of a study in a setting where there's a very low prevalence of hepatitis B in pregnant women. And that is a country such as the United States, as an example. One of the endpoints of the study is to look at a neurodevelopment of these children. So there's absolutely nothing stopping the US CDC and its investigators from going to the United States to explore whether a birth dose of hepatitis B impacts on a neurodevelopmental outcome of babies that receive a birth dose of hepatitis B. They wouldn't be able to address the endpoints of all-cause mortality in the United States because mortality is very low. But for that endpoint of neurodevelopment, which is one of the endpoints where there's a lot of disinformation in the United States, that children's neurodevelopment is being affected by children receiving different sort of vaccines. If that is an issue in the United States, then it should be dealt with in studies that are done in the United States and not on the African continent, where we need life-saving vaccines to be given to our children.
All right. Now, speaking of in Africa, where we need life-saving vaccines to, protect our children, Guinea-Bissau already planned to roll out the birth dose nationwide by 2028. So there are questions that are being asked. Why spend $1.6 million to study a delay rather than using that money to accelerate the the life-saving rollouts? Let's have your thoughts on this, Dr. Tomari.
Thank you, Shaba, for the points you brought out. It's so clear. I mean, as it said, that there's absolutely no reason for carrying out this study in Africa, rather than in the US, where they have all the resources and all the facilities. Looking at the hepatitis vaccine, we do know that generally in Africa, we give it because we don't have the resources to mention which mother is hepatitis negative, which mother is hepatitis positive. They have all those facilities over there. They can run a similar test in their continent rather than coming into a place where we are. Having said that, I think it's been long enough. For example, why is Guinea-Bissau not putting I mean, introducing this vaccine, why is it introduced in 2028 and not 2027 when they initially wanted to do it? These are also issues we must talk about in our own African region. Why is Guinea-Bissau delaying to 2028? What are the children born between now and 2028? What's happening to them? So when we are blaming the donors, we must also look at our own different continent ourselves. I'm sure the money, the resources are there in Guinea-Bissau. If we spend it properly, to at least give these children the vaccine dose they require, rather than wait for 2 years before you start introducing that thing. The way our leaders and live exorbitantly, a little bit of funding to that one can bring this program in this year in Guinea-Bissau. So what are they waiting for? What are they waiting for?
So let's come back to you, Dr. Mahdi. Now, the WHO, the Africa CDC, and the global medical community have all condemned this trial, right? Since they've all condemned all of this trial, is the U.S. Health Department now operating on an island of skepticism outside of international law?
Law, but outside of scientific evidence. And I think much of what they've done in the past few months sort of has got absolutely no scientific basis to it. But I just want to sort of follow up on my colleague's point. And I think what he really impresses and what we need to talk about seriously on African continent is about governments taking ownership. It's about governments taking ownership for our own citizens. Our colleague is correct. There's no reason why hepatitis B vaccine, especially in a country such as Guinea-Bissau, where there's such a high burden of hepatitis B, has not as yet introduced a first dose of hepatitis B. That is something that should not have taken place in 2027, should have taken place decades ago. So it does unmask a bigger issue, and that is the lack of political ownership of the health of our populations. And if there was a political ownership, we wouldn't be having this discussion, because hepatitis B would very much have been a birth dose, would have been very much a routine. And it's not just Guinea-Bissau. It's many African countries. It's only about 25 to 30% of babies that are born on the African continent that are actually receiving a birth dose of hepatitis B, despite it being a recommendation by a WHO for there to be universal birth dose of hepatitis B. So there are bigger issues beyond what is clearly essentially an unethical study that is being suggested to be done in Guinea-Bissau.
All right, so let's hear same question from you, Professor Tomori. Since the WHO, Africa CDC, and the global medical community have all condemned the trial, what do you think? Is the U.S. Health Department operating on its own outside of international law?
I mean, this is not the first time U.S. is doing that. They've done a lot of crazy things before. This is not the first time. They withdrew from WHO, withdrew from every thing. They run as if they own the world. So I'm not surprised about this one. And it's left for us. And I remember Tedros also saying that this is unethical, but it is left for the country to make a decision. It's left for us. I mean, US can do whatever it likes. It's its country, their own country, they can do. But we too must do what we like that benefits our people. And that's the message I think we need to get to our governments. All these running around for the donation, it should stop. They call us resource limited. We are not resource limited. We are resource wasteful and resource squandering nations. And that's what we are. And if you don't know your problem, you never find a solution to it. You'll be at the beck and call of the beggars for the rest of your life. And that's what is happening to us in Africa. If we spend the money we have, if we spend our money well, we won't be begging anybody for anything. And that is the message, Shaba and all of us in our own position. Let's make sure that we get our governments to hear this type of message. And you in the press, it's your job. Let them know, point out to those our government where they are misspending our money and becoming slaves to donors. We can't continue to do that.
Mm. All right. Now, Professor Tomori, if this trial had proceeded and just one infant contracted hepatitis B in the delayed group, who do you think would have been held legally and financially responsible? Is it the U.S. government, the Danish researchers, or the local health ministry?
I mean, it looks like the U.S. government is above the law. If I blame anybody, I would blame the government of Guinea-Bissau that allowed this thing to go on when they know what it is that is going to cause the problem. So don't blame the donor, don't blame the thing. It's us, the government of the country, that accept this nonsense. You know, we are the ones that should take responsibility for whatever it is that happens to any of our children. If we cannot take the right decision on this, then we should be ready to take the button and take the repercussion that comes of it. So I don't have anything to do with America. I don't have anything to do with CDC. I have something to do with the government of Guinea-Bissau and any other African government that would take a decision that will harm its own people, and then we want to shift the blame on somebody else. It's our decision. Tedros said it. This is unethical, but it's left for the country to make up its mind. So let's look at it and face it as it is. If any child in Guinea-Bissau gets chronic hepatitis, it is the government of Guinea-Bissau blame, not US CDC or whoever donor that is coming in.
All right, so let's find out from you as well, Dr. Mahdi. Who do you think would have been held responsible legally and financially? The US government, Danish researchers, or local health ministries?
Trial. The trialists are meant to take out insurance for exactly that sort of cover, but that's not gonna be much helpful. But I think the important thing in the study is that if you look at the primary endpoints, what they were planning to measure, they weren't actually planning to measure transmission of hepatitis B. That doesn't actually feature in the primary endpoints, which means for all intents and purposes, the investigators were not actually planning on identifying whether the vaccine actually prevented hepatitis B or not, and consequently, we wouldn't have known during the period of the study as to whether children did or did not develop hepatitis B if they were in this delayed arm. So there's a lot of sort of opaqueness in terms of how they went about constructing their objectives. In this sort of a study where you're testing an intervention, your main reason for testing the intervention is to know whether it protects against a disease against which it's targeted. And that doesn't seem to feature in the endpoints of the study. So in a way, the trialists here, the investigators, have somewhat sort of skirted that issue by not actually planning to test for hepatitis B in the children. So you would never have known whether children contracted hepatitis B until later in life, when they probably develop chronic hepatitis.
All right, so let's have your final thoughts, Dr. Mahdi.
So look, at the bottom line is a birth dose of hepatitis B is recommended by WHO. It is known to be safe. It is known to be effective. It reduces the risk of babies developing hepatitis and consequently developing chronic hepatitis. There's absolutely no scientific basis, and it's unethical to be performing this sort of study, and more so in a high-burden country such as Guinea-Bissau.
Okay, let's have your final thoughts as well, Professor Tomori.
To go to our African governments and to our people. Enough is enough. Time for us to use what resources we have to do the right thing that we need to do. Begging, asking, calling for donation is never going to help us. And we've seen it on. We need to take the life of our people as the major reason for what we are here for. Governments are set up for the welfare of their people. And this is a message to all African governments. Don't get yourself involved in this slavery that is going on with all this donor funding. Time for us to use the money we have. And we are rich. Africa is not poor. Let's not deceive ourselves. We are not resource limited. We are not resource constrained. We are resource wasteful and we are resource squandering. Let's solve that problem and focus on the welfare of our people. All
right. Well, thank you so much, gentlemen, for speaking so passionately, on this. Dr. Shabir Mahdi, Dean of the Faculty of Health Sciences and Professor of Vaccinology, University of Witwatersrand in Johannesburg, South Africa. We also had Professor Yewale Tomori, virologist and former president of the Nigerian Academy of Science in Lagos. Thank you so much once again, gentlemen.